Hello everyone, welcome to Masters Teach. And today we are going to discuss about the children with special needs. Okay, simply we can say this CwSN. So, children with special needs are learners who requires extra support and adapted teaching methods to reach their full potential. So, these children with special needs, they may have physical, sensor, cognitive, or development difference that impact their learning. So, here the key framework we are going to discuss universal design for learning. Okay, you should know what is UDL, that is a universal design for learning. So, which provides multiple means of engagement, representation, and expression to accommodate all the learners. So, individualized education programs. So, it is like tailor-made educational goals and strategies to meet each child's unique needs. Okay, so we are going to discuss visual impairment and their characteristics and needs. So the visual impairment, the characteristics are so they may see partial or complete loss of vision or difficulty in recognizing the faces, reading print, and navigating spaces independently. So there is a difficulty in vision. So what is the educational needs? So they need a special type of material. So that is called tactical learning materials, auditory resources, and orientation and mobile training. So what is the pedagogical strategies for the visual impaired children? So you may give braille literacy, audiobooks, or screen readers. Okay, so tactical diagrams and verbal description of visual content. So these are the visual impairment and characteristics and needs. So second one, these are the special need children. Okay, so hearing impairment children. So the characteristics are partial or complete loss of hearing. They cannot listen very little or no hearing. So, so which affects speech development. So, learning acquisition also it is very late and communication skills. So, what is the education needs? So, they need to have visual learning aids. They need to have written instruction and clear communication strategies. So, here, how you can teach them, those who are hearing impairment. So, you can use Indian Sign Language. So, here, the teacher is showing the sign language. So, you can simply say that ISL. Okay. Then, speech therapy with the lip reading. So, as well as you can use assistive devices like hearing aids, visual cues, and captions. So, these are for the hearing impairment. So, they may ask about the characteristics of visual impairment and hearing impairment. Then, autism spectrum disorder. Simply, we can say that ASD. So the characteristics are so challenge in social communication. They cannot communicate properly. So repetitive behavior is there. Then sensor sensitivity and preference for routine. So each children on this spectrum is unique. So these are called as autism spectrum disorder. So in TET they may ask what is ASD. You're able to tell autism spectrum disorder. So here the you can the structure of environment you can predict their routines and visual schedule and social skills and training. So explicit teaching and communication pattern should be there. Sensory support. So quiet spaces and sensory breaks. They need to have visual support like picture cards and visual timetable. So this is for autism spectrum disorders. Okay. So as we know, those who have done D.Ed and B.Ed, they all know specific learning disabilities. Okay. Simply we say that SLD. Okay. One is dyslexia, dysgraphia, dyscalculia. Okay. What is dyslexia? So the characteristics are it is they are they face the difficulty in reading like spelling and sometimes they are unable to recognize the words, so despite of having their normal intelligence. So what is the strategies? Okay, you have to train multi-sensor phonic instruction. You have to give extra reading time and audiobooks and colored overlay for text. So this is for dyslexia. That means difficulty with reading, spelling, and word recognition, even though they have normal intelligence. Then dysgraphia. So the characteristics is uh, the challenges with handwriting. So spelling goes wrong, then organizing thoughts is not proper. So so it is related to difficulty in writing, that is called as dysgraphia. So what is the strategies like occupational therapy is required, then assisted technology like for typing, graphic organizer and reduced uh, writing task. So you can check previous my videos, you can have all this. Then dyscalculia. So it is like difficulty understanding with the numbers. So they are unable to understand mathematical concepts and calculation. So what is the strategies? So concrete manipulative should be there. Then visual aids and step-by-step instruction and extra practice time. So specific learning disabilities. Dyslexia, dysgraphia, dyscalculia. So these are the things. Then intellectual disability and cerebral palsy. Okay. So intellectual disability. What is the characteristics? So there is a limitation in intellectual functioning and adaptive behavior. So it affects daily living skills. So the focus should be functional academics, life skills, basic literacy, numeracy, and vocational training they require. So what is the strategies? So task analysis, repetition, hands-on learning, and modified curriculum. Then locomotor disability is also called as cerebral palsy. So the characteristics are movement and posture disorders affecting motor skills, so muscle tone and coordination. So what is the strategy? Accessible classroom design, assistive devices, adaptive physical education, and physiotherapy support is required. So here intellectual disability we discussed and locomotor disability. You should remember locomotor disability also called as cerebral palsy. So these are the thing. It is about the locomotor. It's the physical movement of the body. Okay. So disorder. Okay. So it is about the they have adaptive behavior affecting daily life skills. Then effective pedagogical strategies. So what need to be done for them? So differentiated instruction. So tailor-made content should be given, and process and assessment to meet diverse learning needs. So offering multiple entry point and flexible grouping. So differentiate. Every person is unique and everybody want to have some tailor-made process to learn. Okay, P tutoring. So meaning that so pairing the students for mutual learning. So you have to build the confidence. It builds the confidence and social skills and reinforcement. Reinforce the concept through teaching others. So co-teaching means general and special educator working together in the same classroom support all the learners. Then assistive technology using devices and software like speech to text, screen recorders, screen readers, and communication apps to enhance learning access. So in simply, you have to give the different instruction for the different people, and you should encourage the peer tutoring, like one student has to teach other. Okay, then co-teaching. So online special educator working together in same classroom to support all the learners, and you have to use the assistive technology like using device software like speech to text. So you can find in the mobile, so screen readers and communication apps, so through which they can increase their learning access. Then teacher role in special education. So teacher not only facilitator or guider or motivator. Here in special education, he is the observer. So the teacher has to observe carefully each student's strengths and what is the challenges, the learning style, how they learn, and progress to inform instructional decisions. So teacher is also collaborator. So he has to work or she has to work closely with the parents and with the special educators and therapists and other professionals to create comprehensive support system. So as well as advocates. Okay, the function of special teacher as advocate. So is a champion of rights and needs of uh, children with special needs, that is CwSN. They should know what is rights and laws about them. So ensuring that they should get the quality education and resources and in inclusive environment. So it is our duty that everybody has to get educated. So how to build an inclusive classroom? So every child deserves opportunity to learn, grow, and succeed. As a future educator, you should understand special education pedagogy to transform lives, create truly inclusive learning environment. So you should know your student, their strengths and needs, and you should adapt the methods. So it should be flexible and it should address all the diverse learners. Then collaborative way. So you have to work with the families and specialist therapists. Then advocate fearlessly. So you should know child rights. Okay. Then specialist is not the fixing children, but it's about adapting our teaching to unlock their potential. So let us have some test. Okay. Here is a small thing you're unable to view. However, I'm going to post the same in my app. You can download uh, through Master's Teach, and you can like you can practice these 10 questions. So Thank you for your time. Do subscribe, Masters Teach, and like and share. And also, in order to have PDFs and one-to-one classes, you can download Masters Teach. Okay. Thank you for watching my channel. We'll meet in the next class. Thank you.